everyone. I'm Andrea Kirsten-Coleman, Global Communications Manager at the Vision Impact Institute. And today we have the opportunity to sit down with Dr. Laura DeFina, CEO of the Cooper Insitute in Dallas, to discuss the connection between children's fitness and vision health. Dr. DeFina has been with the Cooper Insitute for 12 years and in her role as CEO for 7 years. This conversation is part of our ongoing focus to highlight the collective power of organizations we partner with to make an even greater impact for vision. We refer to this internally as passing the megaphone. And there's really no better example of this than the collaboration between the Vision Impact Institute and the Cooper Institute. Founded by Dr. Kenneth Cooper over 50 years ago, the Cooper Institute promotes lifelong health and wellness worldwide through research, advocacy, and education. Funded by the Rosewood Foundation, the collaboration between our two organizations began in 2018 with the purpose of raising awareness about the importance of good vision and physical fitness to improve health for the whole child and impact their success in the classroom and beyond. On a personal note, I have been working on this collaboration since the start, and I think our work has really become more relevant during the COVID-19 pandemic when school, as we know, changed everywhere, and in many cases, not only affecting children's education, but also their health, including their vision and their fitness. So on that note, I would like to welcome Dr. DeFina. Welcome.
Thank you, Andrea. Happy to be here.
It's great to have you. For those in our audience who are not familiar with the work of the Cooper Institute, tell us specifically about your organization's work.
You bet. So the Cooper Institute, as you noted, is a 501c3 nonprofit founded over 50 years ago in 1970. So we're celebrating our 50th birthday by Dr. Kenneth H. Cooper, who is the father of aerobics. And our mission is to promote lifelong health and wellness through research, education, and advocacy. In fact, in 1989, we published the first paper that showed the positive relationship between being fit and living longer. Our motto in general is we investigate the relationship between fitness and wellness, we inform the public of the latest findings, and we inspire the world to lead healthier lives now and well into the future.
Great, thank you. There's a definite connection between, you mentioned fitness and working on that first study. There's a definite connection between children being physically active and good vision. Our research suggests that time outside can slow down the progression of nearsightedness or myopia. How did you decide that it would be a great idea to align your organization's work with the work of ours?
So it was really a very easy decision. You already used the word, the whole child, and the Cooper Institute very much believes in caring for the whole child. And we understand that vision is a key component to academic achievement and physical fitness. Our priority with this important partnership is to raise awareness about good vision and the role it plays in helping students achieve academic success and physical fitness.
You've got a tool called the FitnessGram. Tell us how that tool works and how you use that to inform your work on children's fitness.
You bet. So FitnessGram by the Cooper Institute is the leading evidence-based physical fitness assessment and reporting tool that's used to promote health-related fitness for millions of students across the country. And everybody probably remembers when they were a kid doing aerobic activity and muscle strengthening activity. Well, this test gives us an idea of whether you're in the healthy zone and destined to grow healthy, or whether you need to be a little fitter than you might otherwise have been. The assessment, in addition to helping kids, also allows school leaders, educators, and policymakers to make decisions with data that will improve student health. And that very much aligns with our mission of promoting lifelong health and wellness. For example, teachers can use it to say, is my curriculum strong enough that the kids in my class are getting fit?
I love how you're using that to collect the data and then make the decisions on the data. It's a fantastic model. With, you mentioned teachers using the tool. With school really going more online and kids receiving education at home, are you seeing, is the data telling you that children's fitness is changing? Are you seeing issues with children's fitness over this time period?
So that's a fabulous question. And I will actually say that we aren't seeing a lot of fitness results this year because schools have opted against the standardized testing because there is a lot of closeness required to actually do fitnessgram testing. What we are seeing, though, and what the physical activity world is very worried about is the decreased levels of physical activity in kids. With the absence of formalized recess, with the absence of formalized PE, and with sports teams often not meeting, kids are spending less time in physical activity, not just in the United States, but around the world. Also, at the same time, we're seeing studies show that kids are having a lot more screen time. A study in Italy showed that kids had 5 more hours a week of screen time. So, this new approach to learning is definitely putting kids' fitness level at risk and their weight at risk. There's good literature that says even over the summer, you become less fit and you may gain some weight if you're a kid that has a propensity to that. So this longer time period is even more worrisome. The other issue, and I want to just comment about vision health, because I think there's a number of things to consider there. So we haven't known a world where kids have had to use a screen for school, to watch TV, and to do practically everything to keep their lives going forward. So that's bound to cause eye strain. We also know that parents may not be as aware as school teachers about whether kids, it's a vision problem they're having when they're doing their digital learning, or it's a learning problem. So I think there's some risk that vision issues will be missed. And then finally, for the kids that are going to school remotely, they may not have the opportunity to have the vision screening that they would classically have in school, which would serve as a starting point to get vision problems addressed quickly and early.
I think it's quite clear that we're seeing a lot of the same things across both of our organizations, especially with the added digital time. Are you having to modify any of your work as a result of this? Are you doing any added type of awareness work or any other type of work to mitigate for this?
So yes, we have had to make changes, as I noted. Fitnessgram assessment is not being done as much as usual because it does require closer proximity of teacher to kids. So what we really focused on this year was providing resources that would keep kids active, but yet still educate them about their health and wellness. And so what we rolled out last week was the Fitnessgram Playground, which is available for free to the public on fitnessgram.net. The Fitnessgram Playground is meant to focus on both educating kids with fit talks about physical activity and how it'll help their life. Basically push and play physical activity opportunities that are good both for the kid and their parent. They're a lot of fun. And actually a tracker for steps and physical activity. And our hope with that is that in a year when we're not seeing as much PE, when we know kids aren't getting out as much, and we know Fitnessgram assessment is not being done as much, that the kids have a measurable way to ensure that they're being active and being educated on what they need to be active with.
I like how you're including the parental component to that. That's probably key. We talked about kids not being in school being what I would call a barrier to their fitness. A lot of time in our work, another barrier that we come up against is stigmas, and we've just celebrated International Women's Day, and we see a lot of stigmas against women and girls wearing glasses. Do you face similar stigmas, not necessarily gender specific, but do you see stigmas in the work that you're doing that prevents kids from accessing the level of physical education that they deserve?
So absolutely. And, I will tell you, and you've probably heard me say this in the past, that I was one of those kids who never got a patch when I was in school, and it still sticks with me to this day. But absolutely, in the physical activity world, the bottom line is that the physically fit kids do fine. The kids that are not physically fit or afraid for whatever reason of being active find this need to be physically active totally overwhelming, and something that they often believe they don't have the capacity to compete or complete. And they also have a fear that they'll be ridiculed or made fun of, very much like wearing glasses and being called derogatory terms. One of the things that we found at the Cooper Institute through our NFL Play 60 Fitnessgram program is that youth who are doing something that they like are more likely to actually complete the physical activity that they need for health. So it's really important, particularly in the kids who are not the athlete and the kids who are afraid of physical activity, to find activities that they enjoy and encourage the ones they enjoy. I think another thing that's really important is in the media today, the focus is often on a very specific type of body shape and degree of fitness. And in order for kids to be active, we have to represent people of all sizes, races, genders, and shapes, and show that being active is important. I'll give you one little anecdotal example. One of our staff is a trainer, and she trains a young lady who plays basketball. And at one of their training sessions, she actually had a friend with her. And the basketball player immediately said, she hates physical activity and she doesn't want to do this. So our trainer took this as a challenge. And instead of playing basketball, they played a game where they threw the ball against the wall, they captured it and got points. And ultimately, this child who hates sports and doesn't want to do anything was really jumping with joy at the end, because this was an activity that she could do with her friend and she actually succeeded in. So we really encourage, particularly this year, to find things kids like. And in the Fitnessgram playground, we have a variety of options that we hope reach a variety of kids where they're at.
And there's probably no better time period than this to experiment with different things, because it's really out of necessity in many cases. So yes. Fantastic. So both of our organizations are grounded in research, and our research is really near and dear to your heart. What gaps do you think exist when it comes to research, especially as it relates to children's health? And how can we possibly fill those gaps?
So, I think our partnership really focuses on what we need to look at. It is critical to understand the whole child, not just their vision, not just their ability to run, but the whole child. And all children should have the opportunity for safe, fun, and effective education about their health and wellness, including their vision. So the research gap, in my mind, remains number one, looking at the whole child, but number one, understanding the optimal way to deliver the whole child approach, regardless of a child's background, socioeconomic status, or the environment they live in.
Makes sense. All of us who are working in this, what we call public health space, we know that we cannot do the work alone. So that's why collaborations like these are so useful and helpful, in my opinion. What do you see as the benefit to this type of collaboration of different organizations working together on separate subjects, but working, to help a key member like a child?
Yes. So I cannot tell you how strongly I believe in collaborating when you're particularly in different fields. Because first of all, and I'll say it again, but we have to make the whole child healthy and successful. And together we reach a wider audience. And together, when we focus on youth health, the importance of youth health is just amplified. So I think it's great. And I've been a real advocate of our joint program because it does bring our people to eyes and your people to fitness. So it's beautiful.
I love that. That's a great note to end on, bringing someone else's eyes literally to eyes and someone else's eyes literally to fitness. So appreciate your time today. Really appreciate your time. And I really thank you for the opportunity for both of our organizations to forge ahead on this collaboration. It's been a fantastic way, like you said, to amplify our words to different audiences, and also to understand what your organization faces and, in the context of whole child health. So thank you. I appreciate it.
Well, thank you for the opportunity. We are absolutely excited about this collaboration.
Well, I want to thank Dr. DeFina again, the Cooper Institute, and all of you today who came on board to listen. We appreciate that you took that time, and we look forward to bringing you more conversations on the topic of vision health. Until then, you can find more information online at visionimpactinstitute.org, or you can follow us on social media on Facebook, Twitter, and LinkedIn. Until next time, take care.